Hi, I'm Dr. Jeffrey Annamarino from Bellissimo Plastic Surgery and Medi Spa. Thank you for joining us for our Facebook Live program. Today, we're going to talk about liposculpture and body contouring. And I want to talk about everything from abdominoplasties, liposuction, and some of the non-surgical devices that can be used for targeting unwanted fat. And so I want to talk about anything you want to talk about tonight regarding that. I want to kind of talk about some misconceptions and some truths behind what device is best and also what technique is best. So when patients come to see me, and body contouring is one of the most common things that I see patients for, patients want to talk about either weight loss, fat reduction, and also extra skin. And those are three different components. So anytime we talk about body contouring, it is not a weight loss procedure. So that really has to be known to the patient when they come in. Patients will come in and say, I want to lose 30 pounds, or I want to lose 25 pounds, I'm exercising. These devices and these different procedures really don't target weight loss. You do lose some weight because we're taking away some extra fat or extra skin, so you can lose some weight, but it's very little. So we like patients to be somewhere within their 15 to 20 pounds of their ideal body weight, and that's another subject that patients want to talk about. Everybody looks at BMIs now. I think that's just sort of a guideline. I don't use that as a hard and fast rule. BMIs are not specific for just anybody, so we have to use that as a grain of salt. But what I usually tell patients is I want to know where your body lives. So meaning that for your everyday life activities, working, running around with kids, things that you do at home, what's your diet like? What do you exercise? Do you exercise? Where is your weight in all of that? So are there areas of your daily activities that you can clean up? Can you do a little more walking, a little more exercising? Can you eat a little bit cleaner? So those are the kind of things that I usually have patients do if are trying to lose weight. But just picking out a number out of the air is not very helpful. You can't say, I like to lose 30 pounds, but that doesn't really mean anything. So patients that want to do that usually fall short of their goal. So that's the kind of stuff that we talk about. Now, as far as body contouring comes in, so mostly with weight loss after pregnancy is just aging in general. The rule of thumb that I use with patients is body contouring falls within a bell-shaped curve. 25% of patients just need liposuction, 25% of patients just need a tummy tuck, but 50% could use a combination. And the difference between liposuction and a tummy tuck, think about liposuction as removing fat only, and that's what it does. It leaves behind the skin, so you have to rely on the skin's natural elastic properties to kind of stretch back and reshape. A tummy tuck, on the other hand, will remove fat along with the skin in a specific area. So we're going to use Angela here. She's back. She's our favorite model. So tummy tucks are usually this area right here, just above the belly button, down to the pubic area. That's where the skin and the fat lying right below that skin can be removed. We also run sutures from the xiphoid process all the way down to the pubic bone, and that tightens those muscles up, especially for women that have had children, especially in the lower part of the belly. They kind of gets that laxity of the abdominal wall. We can really tighten that up and make that belly a lot flatter. And then the skin that is remaining here will stretch down and make a little incision, bring your belly button back out. So you keep your belly button, and just make it back to where it used to be. And then the incision is way down here underneath your clothing line. So that's the difference between liposuction and a tummy tuck. Now you can combine the two in certain areas. So you can do a tummy tuck and you can liposuction in the hips, but you cannot liposuction up here. So when patients come in and they have a lot more fatty or adipose tissue and a little extra skin, then liposuction will be a way to debulk all of that fatty tissue, and then we'll see what the skin does. So that's how I sort of look at patients when they come in. Am I looking more at fatty tissue that they don't want or excess skin that they don't want? So when we talk about liposuction, and I kind of want to spend some time talking about liposuction, the modalities of liposuction, because I want to compare that to some of the devices that are on the market for targeting fat non-surgically. So liposuction can be done in a number of ways. Sometimes we can just use, just like in the old-fashioned ways, you just use a hollow cannula. You make tiny little incisions for the belly button. I make a little 4mm incision, 3 of them on the front of the belly, and then 2 on the lower back to get to the back of the hips. So you can use just a hollow cannula and go in and just aspirate the fat. There are other modalities. So I also, now I actually combine 2 modalities. So the way I do it is I use a Phasor Liposuction, which is a solid cannula. I insert that first. I ultrasound the entire abdominal wall, hips, arms, back, wherever I'm going to liposuction. And I use that until it emulsifies the fat or liquefies the fat in that area. Then I use a hollow cannula. This was called a power-assisted liposuction cannula, and it vibrates. And so that helps remove all of the liquefied fat. The reason I use those 2 is I think it gives you a much better finish. So it's a much smoother contour. Very rarely do you leave little pockets behind. So when you use a straight cannula and only a cannula, sometimes you can leave some fat, mostly around the belly button is the most common area, but you can leave little pockets of fat that you might miss at surgery and you have to come back and do some touch-up. The way that I've been using with the Phasor first, and then at the same, right afterwards at the same procedure using the power-assisted liposuction, I think gives me the best results. There are other ways. So you might have heard of laser lipo, where the liposuction cannula uses a laser to sort of evaporate or to liquefy the fat. To me, I just think ultrasound is a little bit safer. So in my hands, that's what I'm used to. And so just a word on that. Liposuction, just like anything else, is also is depending upon the modality that you use, but also on the experience of the surgeon that's doing it. So those 2 combined. So there are some surgeons that feel very comfortable using the laser lipo. I feel very comfortable using Phasor and the power assisted. So it really just depends on what the surgeon is really comfortable doing. There is something now that patients or surgeons have been marketing called Lipo 360. It's just a marketing term. It's nothing different. It's not a special technique. It's not a special modality or device that they use. It just means that they do circumferential. Well, we've been doing that since the beginning of time. So, surgeons that say that they do that are really not any more specially trained than the rest of any other plastic surgeon who does a lot of liposuction. So again, experience. When you talk about Lipo 360 of the abdominal wall, we're talking about the hips, the flanks, and the belly all at once. You can do circumferential around the arms. You can do inner and outer thighs. I don't do the front and backs of the thighs, and we'll talk about that in a few minutes, but you can basically or liposuction pretty much from head to toe. Some of the most common areas I'm seeing are under the chin, somewhere all around in here. You can go back up. Some people are developing some fat deposits on the upper back, what we call a buffalo hump. You can do the arms, especially for women. Back, the back, where women call this bra fat. We can do the hips, the abdomen. We can do inner and outer thighs. We can do calves. You can do ankles. So there's really a lot of areas that we access with different size cannulas. So you can use larger and smaller cannulas to access those areas. And you can use the Phasor in those areas as well. So, I hope that kind of explains maybe the Lipo 360. It's just more of a marketing term, but it's nothing special. People that are candidates for liposuction is really anybody who has unwanted fat. We all have a genetic predisposition. Most of it's, love handles, hips, upper part of the belly, especially for women in menopause. We've talked about this in the past. I'm finding that a lot of women in menopause are really starting to get a lot of fibrous fatty tissue in the upper part of the abdominal wall. Along the lower part is very common, inner and outer thighs. Here is where the women call this the saddlebag area. Those are common areas, and those are just, a lot of that is just genetically predisposed, and those are all accessed with liposuction. So those kind of patients, again, we'd like to have the patients somewhere within, 15 to 20 pounds of where they just should be ideally. So downtime for liposuction. The nice thing about liposuction, the incisions are very small. Again, we're talking about 4 millimeters. So the downtime is minimal. Most patients, depending upon your job, but most patients are back to work within the week. 5 to 7 days. Patients can start exercising really between the first and second week if they feel up to it. I have everybody using compression garments. It's really a matter of controlling some swelling and for comfort. A word on that, compression garments range from just very basic to very fancy, moderate price to very expensive. I think the garment industries have done a good job of marketing, but I think also that they're kind of telling patients that if you don't use theirs, you're not going to get the same result. Remember, it's the surgeon and the technique used at the time of surgery that's going to give you your results. Compression garments are to help maintain sort of that support as you're healing. It will help control the swelling, help control your discomfort. But at the end of the day, it's really what the surgeon did at the table that's going to give you your overall shape. So I do use those. I have patients using them until they just feel like they don't need them anymore. But I do not rely on any compression garment to give a shape. That's something that I didn't do on the table. All right, so that, just a word on that. So liposuction, very quick turnaround. It's actually very well tolerated. Patients can start using Motrin, ibuprofen right afterwards. It's not a surgery that I really worry about. I do give some narcotics for the first 2 to 3 days, and that's about it. It's otherwise well tolerated. So I hope that answers some questions about liposuction. Now, we have gotten also into an industry where there are non-surgical devices, and the technology is growing rapidly in that arena. So we've been using non-surgical devices for about a decade now, and we've heard of things like Sculpture a while ago. Probably the most well-known brand right now is Sculpt. There are some other ones that are coming out. Sculpt is another one. We've looked at all of those, and we looked at them pretty closely. I just wasn't really convinced that they were giving consistent results. So the one that I chose is actually this device next to me. It's called PHYSIQ. It's made by an Italian company, DECA, which also makes my CO2 laser you see over my shoulder here. And our other hair loss or hair reduction laser called Modus. We've hit great results with both the CO2 laser and the Modus. They are absolutely, honestly, the best on the market. When this device came out by DECA, I took a chance on that. I really like this device. It is, again, a non-surgical. It uses heat compared to some of the other ones that are using some freezing techniques. So this one uses heat, and it can also combine with muscle stimulation. So it's the only device on the market that can combine those two modalities. Nobody else has been able to do it yet. So you can see that there are 4 paddles here, and this is the device that can use 4 paddles. Most of the other ones have 2. So you can usually treat 4 areas all at once. So the most common areas, you usually have one in the lower abdomen, and you can use the hips. We can do lower abdomen, upper abdomen. We can do front and back of the hips. You can do inner outer thighs, front and back thighs. You can also do arms with this device. The nice thing about this is that you can come in, it's really no downtime. Most treatments take anywhere from 30 minutes to an hour, depending upon what areas we're going to be treating. They usually take about 5 different treatments, about a week to 2 weeks apart. We found that gives our best results. You can come in, basically patients will watch something on their phone, read a magazine, read a book, and that's about it. 30 minutes later to an hour later, you can go and do whatever you're going to do that day, come back in a week or 2 weeks and start and continue down the process. The nice thing about this device as well is that you can individualize it. So you can have patients you really just want to target with heat. And so you can just basically treat them with heat. You have other patients you might only want to treat with muscle stimulation. You can also combine the two to give a combination on that same treatment. So it's really individualized. The other nice thing is that it really takes about half the time of some of the other devices. There are some things that are coming out with some of the other devices with maybe some thickening of fatty tissue. We haven't seen it with this device. The downside of the devices is that, yes, they're non-surgical, so they're not going to be as accurate and not going to be as profound as liposuction. Liposuction is nice because it's a one-time treatment. This will take 5, maybe 6 treatments. The results, we really want to pick that ideal candidate. We want somebody who's otherwise pretty fit and has some pockets, but not overall. If you have somebody that comes in where I might think it might be 3 liters of aspirate for liposuction, this would not be a good device. We really want to target love handles, the saddle bags, a little bit on the lower part of the abdomen. We really want to target those areas, and we've had really good success with that. The other nice thing about this device is we're starting to find that it treats, and we're seeing some improvement in cellulite. As I mentioned before, the front and the back of thighs, especially for women, are bothersome areas. Lots of ladies come in, they have a little bit of dimpling, a little bit of that crepey skin. There's really no great modalities for that. Thigh lift doesn't really treat that area. Liposuction in those areas, you have to be really careful. I usually do not liposuction that. Sometimes I'll go in with just the Vaser and just ultrasound that area and dissolve some of the fat, but I don't liposuction the area. It's a very high, it's a high rate of complications with waviness and actually making the cellulite maybe even a little bit worse. What we're finding with this device is that you can put 2 paddles wherever you need it, 2 in the front or 2 in the back. You can treat one leg at a time, or you can treat just the front of both legs at the same time. So we are seeing some improvements already with the cellulite. So the nice thing about this device, again, no surgery, no downtime, you're in and out, but you have to do it over about 5 different treatments. And the results have been good. But again, if you really want that knockout, you really want to be sculpted and really the fine tuning, then surgery is always going to be your best choice at this time.
Does the fat ever come back?
That's a great question. It's a lot, especially with liposuction. I hear that a lot. Patients will come in and say, I had a friend that had this done. They had their hips removed, the fat in their hips removed, and then suddenly their legs get bigger. It doesn't come back, it gets sucked away. But remember, we don't remove all of the fat, we contour it. So some of those areas that are extra bulky because of our genetic predisposition, we slim that down to where it is a normal contour, but there's still some fatty tissue in there, and those fat cells can get larger. So liposuction and this device gets rid of fat, but not all of the fat. So the fat that's remaining can still gain weight and lose weight. You're going to gain and lose weight more uniformly. So what ends up happening is a lot of us, we don't step on the scale every day. We use sort of our clothing to sort of be our benchmark of, am I gaining weight because maybe your shirts don't fit or the belt buckle, the belt's getting a little bit tighter. When you take away those areas, you may not notice because that has always been sort of your yardstick, and now you have to change your yardstick. So as you might be gaining weight, you might see it in other areas that you were not seeing before. They were already there, but you notice the hips or the saddlebags first, but those areas have been corrected. So now you have to be a little bit more careful about your eating habits just because you're going to see some of that weight gain in other areas.
How do you determine which device, treatment, or procedure is best for you?
Well, I think that's, for me, I think that's why it's so important to come in for a face-to-face. We can do a little bit online and over the internet, but I think that seeing somebody face-to-face, really talking to them, what are your goals? I mean, again, if you start getting into that bell-shaped curve, do you really want to reduce the fat? Do you want to take away some skin? Is it a combination? Because sometimes we would say, okay, you know what, it's going to be a 2 procedure. You might need a tummy tuck down the line, but right now we want to debulk that area. So let's tackle it with some liposuction first and then do the tummy tuck. Maybe it's just a tummy tuck. I have patients that will come in really, really thin. They have some extra skin because of pregnancy. They may or may not be ready to do a tummy tuck at that point. So, and that's just their best choice. They'll come in thinking they want liposuction. And so that's why a lot of times it's hard to do that over the internet or on a virtual consultation. But in the office, I can show them, I can kind of feel the skin, find out how much tone is there. So when we talk about liposuction, we're going to rely on the bodies of that person's elastic principles or properties of the skin that are still remaining. If it's been stretched out through pregnancy or weight gain and weight loss, then I'll have a good idea and a good sense of telling them you might have a little extra skin, or this should redrape nicely, so liposuction would be a better choice, and we can go through that. And again, same thing for our PHYSIQ device. You know, some of those patients that may not want to go through surgery, they think PHYSIQ is the best way to go. They may or may not be a good candidate for that, so we can talk about it when they come in. So that's really where the fine tuning comes in, and having done body sculpting for more than 20 years, I feel pretty comfortable picking the device depending upon what the patient's goals are.
Can you tell me again what areas can be treated with liposuction?
So liposuction, again, one of the most common areas that we're treating now, especially for ladies, is really under the chin. They want to have that defined jawline. It's not just the little fat pocket that some patients can get, but all the way back to the angle of the lower jaw, all the way down to the thyroid cartilage. And so we can really kind of come in and tune that up. So that's one. We can do chest, we can do abdomen or bellies, we can do hips, we can do the back, we can do bra fat, you can do arms, and that's a big area, especially for women. And I try to get all the way up to the top of the back of the shoulder to really take away and contour that deltoid muscle right here, so that really shapes it. So you can do 360 degrees around the arm if you need to. Most people just need it in the back. You can go to, again, the inner and outer thigh. That's what I would treat. I don't liposuction. You don't want to liposuction your buttocks. Someone will come in and say, you know, I want to make my butt a little bit smaller. Again, same thing, same principle. There's a lot of fibrous tissue holding that tissue, that skin to the underlying muscle. You start liposuctioning the buttock itself, you're going to get some waviness and some dimpling, and nobody likes that. Same thing with the anterior or the front of the thigh and the back of the thigh. You can also do the calves, giving it a little bit more shape, and you can come around the ankle, so you can take away that fullness at the ankle and give a little bit more shape from the ankles to the calf area. So those are the common areas with liposuction.
And you mentioned aftercare, wearing a garment or support. Can you tell me exactly what you mean with that?
Yeah. When I do liposuction of the what we call the submental area, sometimes I just use some tape and some steri strips and kind of hold this area up. A lot of times I'll put patients into some type of a compression strap or compression garment, even for their chin area. For the chest, I either use ace wraps or an abdominal binder, the same thing around the belly and the hips. And it's just a big, Velcro strap that goes all the way around. It's adjustable. You can also use compression garments, Spanx. For the thighs and calves, I have patients bringing in compression stockings that come up to their thighs. After surgery, you can certainly use yoga pants, compression pants, anything you want. Most of the time, they're wearing those really around the clock for about 3 to 4 weeks. And then after that, by that time, by 2 to 3 weeks, they're really back to exercising. I usually have them at that point only using it for their comfort and when they exercise. And then over the next 2 to 3 weeks, really sort of transition out of it to your comfort level. So thank you again for joining us. I hope that cleared up some of the miscommunication that might be out there and kind of highlight some of the things that we can do here at Bellissimo. If you want any more information, just go ahead and contact us here at the office. You can also find us at BellissimoPlasticSurgery.com and on social media. So thank you again, and we'll see you next month.